I'm interested to ask you actually how the physicians you're finding in Intermountain are adapting to different models of this taking healthcare to the patient.
Well, I think that the key thing that you have to keep in mind when you're working with a group of physicians is, first of all, they're working very hard. They have many things they have to accomplish in a given day. And if you're going to undertake an initiative like this, you need to come to them with the resources to do that, do these new jobs. And to a certain degree, you have to align some incentives as well. But that's really second on the list. The first thing is, do I have the time and the team around me to do what you're asking me to do? So when we undertake anything like this, it's always about, do you have a nurse care manager? Do you have a care guide? Who's on your mental or behavioral health team, psychologist or a prescriber? And that's the first part that you have to attend to. So it's, if you're asking for new work and new jobs, you've got to make sure that they have the tools and the resources to do those things.
Well, I see this as a real challenge over the next few years around the world, but particularly in America, as the reimbursement models are changing. We're going to be living in the double world for a while, I think, the bimodal world of the fee-for-service, the traditional model, and for a lot of acute practices that's still necessary and valid. And we're also moving to this not quite yet pay for performance, population model, and so for a lot of physicians this is a really difficult balance. Quite different service models and engagement models, different teams. I think this is going to be really challenging for a while.
Quality improvement, it's all based on relationships. So whether it's that relationship with your patient at a personal level or the relationship with the physicians that are part of your network that's taking care of the population, it all comes down to people in the end, and that you really have to be laser focused on that.
On that.